My name is Melinda Skirvin, and I'm here today to speak to you about a new service that I'm proposing for Memorial Hospital West. It is the addition of a community health service. Community health is very similar to public health in that it addresses the health needs of a specific region. It is a more proactive approach to healthcare. Community health focuses on prevention, education, and resources versus a treatment for a condition once it has already manifested. I'm going to describe the City of Pembroke Pines and give a little history of the hospital. I will propose to the hospital that adding a community health service will help decrease costs, provide better health to the region, and help to provide a sustainable health care for future generations. The City of Pembroke Pines is a city in southern Broward County and was incorporated in 1960. It is densely populated with very little free space. The city has a mixture of business and homes, with most people owning their homes. There is public transportation, however, most people don't use it. They depend on their own vehicles to travel between locations. The city has many community resources given its size and is very well maintained with a higher median home value and cost of living. Pembroke Pines has its own fire and police services and has a lower than average crime rate. The City of Pembroke Pines offers an excellent quality of life for the people that live in the community. The City of Pembroke Pines offers a nice resource of primary care providers, but is really lacking in community health services. There are many sources of primary care within the zip code and within the City of Pembroke Pines. There are at least 21 primary care physicians within the zip code and at least 6 walk-in clinics. The city has Memorial Hospital West, which is part of the Broward Health System. It was built in 1992 with 100 beds, but has since expanded to 384 beds due to the demand of healthcare. Every home within the zip code has access to primary care within minutes. The population of the zip code 33026 is 30,911, with slightly more females than males. The population density is high at 6,823 per square mile. There are 12,462 homes and condominiums with 2,060 renters. There are 18% renters compared to a state average of 36%. Most of the people living in Pembroke Pines have at least a high school diploma at 94.6%. 42.2% of all of the adult residents in the zip code have a bachelor's degree or higher, and 16.2% have a professional degree. The median average age of the resident in Pembroke Pines is 43.7 years old, and the average household is 2.7. The people in the community have a higher education than the state average. The population is dense, but the city is not a large city. The City of Pembroke Pines has a higher average income. The average household income is $60,477. The average salary is also higher, with the annual average salary of $54,961, compared to the state average of $45,277. The cost of living index is higher also, with an index of 113.7 compared to an average of 100. Most of the people that live in Pembroke Pines are homeowners and not renters. Half of all of the adult residents have a bachelor's degree or higher. The median home value is $243,070 compared to the state average of $197,700 for the state of Florida. The socioeconomic status of the community is higher than most of the state of Florida. The community is not diverse, however, with most of the residents being either white or Hispanic. There are 14,148 white residents, 9,411 Hispanic, 3,248 Black residents, and 1,031 Asian residents. Many of the Hispanic residents moved to Pembroke Pines after Hurricane Andrew hit the Miami area, displacing them into South Broward County. The Hispanic influence can be seen in the restaurants and in the shopping area. There are 4 elementary schools in the zip code of 33026 with over 4,200 students. There is no middle or high school in that area, and those residents have to attend high school and middle school in surrounding schools. There are exceptionally good educational opportunities within the city of Pembroke Pines. But what about the health care? The city has 1 hospital, as mentioned earlier, with 384 beds, and has 21 primary care physicians and 6 walk-in clinics. But that's not the answer. The city has good healthcare resources in general. The hospital has a great reputation, and there are an adequate number of healthcare providers. But the city does not have any community health program. There is no service available to help promote preventative care and community health. The services that are available only address health concerns after they present. The service that should be added to Memorial Hospital West is community health. There is a great need for this service. It would help to elevate the overall health of the community and would allow the health providers to provide support and direction prior to an emergency need. Community health is the intersection of healthcare, economics, and social interaction. It is a medical specialty that focuses on the mental and physical well-being of the people in a specific region. It is an important subsection of public health, which helps community members to maintain and improve their health, prevent chronic disease, and to prevent the spread of infectious diseases. Community health promotes healthy living and brings the greatest benefit to the greatest number in need. This service would provide education, dietary services, clinical support, as well as social services support to the citizens of the city. These services would enhance the health of the citizens, lessen the burden on the healthcare system, and save expense to allow for a more sustainable healthcare system. The organizational chart for the community health system would be the community health director that leads the department, the community services coordinator who would report to the director, the administrative staff, and the referral specialist that would support all of the service lines within the department and would report to the community services coordinator. There would be 5 service line coordinators that would report to the community service coordinator. The 5 leaders are the dietitian, the education coordinator, the social service coordinator, and the clinical service coordinator, as well as the outreach coordinator. Each of those service leaders have direct reports. The diet techs would report to the dietitian, the instructors would report to the education coordinator, and the social workers would report to the social service coordinator. The community nurses and home health aides would report to the clinical service coordinator, and the community workers would report to the outreach coordinator. In conclusion, the City of Pembroke Pines offers an excellent quality of life and a nice resource of primary care providers, but it's lacking in community health. Community health services should be added to Memorial Hospital West. There is a great need for this service. It would help to elevate the overall health of the community and would allow the healthcare providers to provide support and direction prior to emergency needs. I have finished this race and I could not be happier. You may ask me, what am I going to do next? I am going to Disney World. Thank you.